Morning, nice to see you all. We're just here to give a quick update on the tremendous progress that we've been seeing in terms of our employee vaccination policy. I am so grateful to so many of our employees who have now, over the last week or so, continued to go out there, get vaccinated, get boosted. So just to review the numbers, since December 20th, more than 1,600 employees have submitted proof of vaccination additionally. And so we are now at more than 94% of our entire City of Boston workforce that are vaccinated and in compliance with the city's new policy. That is a total of 18,270 employees who have gotten vaccinated in line with this policy. I'm incredibly encouraged by this progress, and we continue to have very productive conversations with our union partners about the collective bargaining impacts, and we are giving this one more week to make sure that we realize that progress. Almost every department is at more than 90% vaccination rates across the city. And so a couple examples, just to get into the weeds on this. Our Boston Public Schools are at a 94% vaccination rate. Boston Police is at more than 95%. Boston Fire is at 91%. The Boston Public Library is at 95%. Inspectional Services at 96%. And our Parks Department at 97% vaccination. Several departments, many of them, are fully at 100% vaccination. So thank you so much to our registry and treasury departments on the second floor here in City Hall, to the clerk's office, to the Office of Economic Opportunity and Inclusion, to our Youth Employment and Engagement Office, to our Office of Streets, who are all at 100% vaccinated. So as you've seen, we are giving our employees one more week to get vaccinated, and that means that there will be no unpaid leave between January 25th and January 30th. We're going to continue prioritizing communication with our employees and unions, and there will be multiple vaccination clinics hosted throughout this week as well. Okay, entonces desde el 20 de diciembre, más de 1,600 empleados aprobaron la prueba de vacunación. Entonces, en total, 18,270 empleados cumplen con la regla de vacunación. Casi todo de nuestros departamentos están en 90% o más de vacunación, y esta semana continuamos las conversaciones con todos los uniones y otros empleados en la ciudad. Y esta semana también tenemos estas clínicas para vacunación en barrios de Boston también. Okay, so I will hand it over now to our Executive Director of the Boston Public Health Commission, Dr. Bisola Ojikutu, for an update on our COVID numbers across the city.
Thank you, Mayor Wu, and thanks everyone. Obviously, vaccination is the most important tool that we have to mitigate the impact of COVID-19, and that's why this requirement for city employees is just so critical. I just wanted to say a few words just about what we're doing citywide to ensure access to vaccines for our city employees. Over the course of the last few weeks, we've held numerous vaccine clinics for Boston Fire, Boston Police Department, the Boston Public School staff, including teachers, paraprofessionals, and other critical frontline workers. And in addition, we have been holding twice weekly vaccination clinics right here at City Hall. Tomorrow is our next clinic here on Tuesday from 10 to 4 p.m. and Thursday from 12 to 6 p.m. I think that this is just really incredibly critical as we try to encourage vaccination just across the board. I would say that there's quite a bit of reason to be hopeful right now in the city of Boston. For several weeks in December into early January, our vaccination rates didn't increase. More recently, we have seen a significant increase in new vaccination uptake. From the first to second week in January, we noticed a 36% increase citywide, and then from the second to the third week, another 17%. Overall, 70% of our residents are currently fully vaccinated, and more than 82% have received at least one dose of the vaccine. I also just wanted to update you on a couple of metrics in regards to the surge. I know everybody's obviously following that very closely. As you may recall, our highest positivity rate in Boston was over 32%. As of last Friday, so this is through last Friday the 24th, our community positivity rate is now 18.9%. Though we continue to see increased new cases, our number of new cases is down about 50% from the previous week. Our emergency department visits are down by 16%, and I think that things are overall going in the right direction. I just want to encourage you that it's important for us to make note of the fact that hospitalizations still remain extraordinarily high, and they're up 12% from the previous week. So we need to continue to be cautious, continue to mask, continue to test and isolate in order to get through the surge. So I'll stop there.
Questions?
Total in the city of Boston?
I don't have that. I will make sure that you have that number. I think everybody's looking for how many employees are not in compliance. Is that what you're asking? I don't have that number. We know that the total is 94% vaccinated as of this point, and that is 18,270 employees. We're giving our employees one more week because conversations are going very well with several of our municipal union partners, and looking to make progress and see where we are at the end of this week. But this policy will be implemented, and we're getting there. We are basically there. Yes.
What message do you have for some of the people who are frustrated with this community, especially like the protesters who are standing outside and feel like this is unfair?
I'm so grateful to the vast majority of city employees who have already gotten vaccinated, and the more than 1,600 employees who have additionally gotten vaccinated since the census policy was announced. We know that across our workforce, everyone is trying to do the right thing, and we know how important vaccinations are to keeping individuals and families and our community safe. So we will continue working with our city municipal union partners. This policy does represent an important step in our pandemic and in this moment of emergency. So we'll continue to work with everyone over this week, and this policy will be going into effect shortly. Yes, there have been, let's see, my last number was 609 exemption requests that have been received. Our individual departments, our personnel departments, are still working through these because it is a case-by-case analysis, and there's medical documentation required in many cases as well. So a number of these have been granted, and a number are still being processed.
Mayor, you announced this policy on December 20th. Why are we giving these employees more time to comply? They've had over a month at this point.
Yep. Even in the last week, as the deadline loomed, we saw great progress in people just taking that extra step, making their way to a vaccination clinic. This is part of the collective bargaining process with our municipal unions as well, and so we have been seeing some major steps forward over the weekend with several of our unions, and so we're looking to continue that and give it one more week to make sure that we can get close to an agreement there.
You said those conversations are going well. Who's meeting with who? Can you speak a little bit more to what is happening in those?
Our Office of Labor Relations has been meeting with every single collective bargaining unit in the city. We have a proposal out with the Boston Police Patrolmen's Association as well, and continue to have meetings with others throughout this week. So when a policy is, according to the collective bargaining laws and the arrangements with the city and its municipal unions, when a policy is implemented that is going to have impacts on a workforce, there's what's called impact bargaining that goes on. And so we've been in conversations with each of our municipal unions about what these impacts might look like. Again, the vast majority of our workforce is already vaccinated. But for example, the implementation of details of this in terms of, for example, with the BPPA proposal that is now being sent to their membership, there are some details about if someone is vaccinated a certain number of days after the deadline, Could they have the chance to re-interview for their job or come back to their job? It's those kind of specific process details.
Is it accurate that the city intends to honor the provision of the MOA with the Boston Teachers Union that allows them to keep testing until June?
We're still in conversations with the Boston Teachers Union, but that is not the that is not where we are at this moment.
Is it possible that you guys would extend the deadline once again if the numbers of people vaccinated doesn't climb this week between now and the new deadline that's on Sunday?
We're giving one more week because we are getting close in conversations with several of our municipal unions. And so to respect the collective bargaining process and to honor the tremendous progress that we continue to see as workers access the vaccination clinics we're hosting, we're giving it one more week.
You listed some of the departments. I know you didn't list every single department, but based off those numbers, does the fire department have the worst compliance so far?
It's hard to. So I think the technical answer is no, because there are some departments that are very, very small, and so if even one person is not vaccinated, then it kind of skews the numbers. But in terms of our very large departments, the numbers basically are in line with the citywide average, which is 94%. The plan at this point is that when this policy comes into effect, those who are not in compliance with the vaccination policy will receive notification and be placed on unpaid leave. That is what's on the table right now with BPPA, and we continue to have conversations with other unions as well. We continue to meet with all of our municipal bargaining units, and the Office of Labor Relations has been going through all of our impact bargaining sessions and conversations, and so we are looking to do the right thing for the city in terms of keeping all of our constituents and city workers safe. So I'm really grateful that 91% of our fire department is already vaccinated and the vast majority of our city workforce overall, and we are working within the legal rights of the city to implement what is best for our public safety and public health.
Should the public interpret your second postponement as a wavering in your commitment to enforcing this policy?
The second week. Sorry?
Postponement. How should the public interpret this? Are you wavering?
We are very clear that this policy is necessary and important for the public safety and health of city workers as well as the public at large, and we're working through the collective bargaining process to implement this in a way that will bring our municipal partners along with us. So I'm feeling good about the progress we're seeing in this one more week that we are giving our workforce to get vaccinated. This should be one more week for our city workforce. We will not wait until every single city worker is there before implementing this, but because we have seen such progress over the last week and because there have been some important steps forward in conversations with our municipal union partners, this week is important for one more week that our employees will have. The deadline right now is January 30th, and I expect that all of our city workers who choose to get vaccinated will do so before this time. We're making several vaccination clinics available this week as well, and then we will move into implementation of the full policy.
We're about staff levels at all. I know the fire department raised that issue on Friday at their press conference that there could be some issues. Is that a concern?
I want to acknowledge how much strain and stress all of our city workers have been under over the last 2 years of the pandemic. And so while we do know that we will have the staffing levels to be able to keep everyone safe and maintain city services without any sort of interruption. We have plans in place along every department on those lines, but I want to honor the work that our city workers have put in and make sure that we are moving towards a staffing and support structure for all of our city workers, that people feel like they have the supports they need to be able to continue to do this work in a very difficult time.
On a separate subject, there was an accident involving an MBTA train in Bloomington over the weekend, fatal accident. They blamed human error. You've been outspoken about concerns about the MBTA. Does this give you pause to maybe raise more concerns in your mind?
I am just heartbroken on behalf of the city of Boston for the family of that commuter, and have read the tributes to her and what an incredible person she was. It is unacceptable that we are seeing anyone doing what they should be able to do every day without thought, go up, walk around our MBTA infrastructure safely, or take a train and go to work, or just know that they are accessing the right to get around our city and our region. And so we will continue to work in partnership with the MBTA to ensure not only reliability and expanding the service to the levels that we need, but also safety as a baseline for everyone who interacts with our system.
Do you think that this sets you back in terms of collective bargaining with other unions? You talked about collective bargaining as an important pathway for police reform, for example. Does this put the city in a more difficult position for that going forward, given the trouble? Given the disputes now with these unions, will that make it harder going forward?
We are now 2 months into some very intense conversations with many of our union partners across the city. It's been incredibly productive, and we're getting to a good place with several of those unions. And so this is not instead of conversations related to larger collective bargaining and the contracts overall. This is an important part of what we need to keep our workforce and our city safe, and we are bargaining it on the timeline with the urgency that requires. But if anything, it's set the tone and created the conversations that will be productive heading into larger contract negotiations as well.
These negotiations include payments for employees to get vaccinated?
I won't rule anything out because our labor relations team is still talking with each individual union, but in terms of what's been offered so far to the BPPA, I think those terms are what's on the table for that particular union, and that's what we've put out there so far.
You're right. We have increased access to testing throughout the city. We have testing at the bowling building, at the Lilla G. Frederick Middle School, and then we will be opening testing at the Jubilee Church in Mattapan. So we have definitely increased access to testing, and that's an important strategy. But it doesn't supplant or remove the need for vaccination. Testing, even if you're testing regularly, does not catch all transmissible infection. What we're doing with vaccination, at least the initial primary series, and hopefully getting people boosted, really decreasing the risk of new infections, decreasing severe hospitalization. There's really a wide array of benefits to vaccination, and that's what we hope that all of our city workers will take advantage of, as well as the city residents of Boston in general.
So testing will be in addition to vaccination. Good. Great. Thank you, everyone.